The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Hello, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. A year ago, I released an episode called Blood Test for Multiple Cancers. Yep, it exists. And it was about a test called Galleri that looks for over 50 different cancer biomarkers in your blood in an effort to catch a problem early. Now I am repeatedly seeing ads on social media for whole body scans that are used as a screening tool, meaning the test is done just to see what's going on in your body rather than doing a specific test to check for a specific problem, like doing an abdominal ultrasound to check for gallstones in someone with right upper quadrant pain. We are going to rerun the August 2024 episode about Galleri testing, but first I'm going to tell you about these whole body scans that are being advertised and review the pros and cons of doing this type of testing. So first of all, what does it mean to have a whole body scan? Well, whole body scans use MRIs, usually magnetic resonance imaging, to examine your entire body. These medical scans can identify signs of injury or disease. The companies that offer this product state that they can be valuable for detecting health issues that aren't visible or show no signs yet. Whole body scans provide detailed images of internal body structures, and the most common type of full body testing that is advertised on social media are MRI scans, magnetic resonance imaging scans. They create detailed images of the body's soft tissues. MRI scans do not involve the use of radiation, so they are safer than imaging like a CT scan. CT scans are also offered by these companies that you are seeing popping up on your social media. CT scans are commonly used to detect bone fractures, tumors, and internal injuries. Before jumping into having this type of imaging service, I recommend that you consider the advantages and disadvantages of whole body scans. I'll start by listing the main benefits of this type testing. Having a full body scan can provide early detection of health issues. They can identify cancer, heart disease, and organ damage before they get worse. MRI, CT, and other medical imaging procedures are non-invasive. However, remember that CT scans do involve the use of radiation, and an MRI test can take 20 to 60 minutes to complete. Since full-body scans can detect health issues without needing invasive procedures, they can provide peace of mind for some individuals. Problems found on imaging can give you and your provider the opportunity to make decisions about lifestyle changes needed to either prevent a worsening of a problem or actually have a resolution of a problem. There are some negatives about having this type of screening testing. It is possible to have false positives and false negatives. Sometimes these tests can be inaccurate, leading to these false positives and negatives. If this happens, you might end up having unnecessary tests or treatments you don't need, or you might think you don't have a problem when you actually do have a problem. As I mentioned earlier, CT scans use radiation. Unnecessary exposure to this radiation can increase your risk for conditions like cancer or skin damage. Really think twice before having a CT scan, especially if it's just for screening or it's unnecessary based on your health history. Full body scans can detect minor abnormalities in the body that might not even cause any health issues, but can cause undue stress and lead to unnecessary invasive procedures. You might worry about something that doesn't even need to be worried about. Opting to have this type of testing could cause some financial strain and stress. These services run from anywhere from $500 to $4,000, and insurance doesn't typically cover this type of screening testing. However, both companies I will talk about in a minute take FSA and HSA cards for payment. A couple of companies that provide this type of testing are Ezra and Prenuvo. The company called Ezra offers an MRI of the head, neck, abdomen, and pelvis. That's their main MRI scan. The arms and legs are not included in this MRI. They charge $499 for this imaging, and it takes about 22 minutes to complete. They also offer an MRI with spine that includes the parts of the body I just listed, plus the spine, for a cost of $1,499. You will be in an MRI machine for 47 minutes to have this testing completed. At Ezra, you can also get an MRI scan with skeletal and neurological assessment. It includes everything in the MRI scan with spine and scans for signs of neurodegeneration, multiple sclerosis, and dementia. It adds brain age analysis and measures fat and muscle volume. It also includes MR imaging that evaluates the health of knee and hip joints. This option involves having two 60-minute MRIs done and costs $3,999. This company also has a CT of the heart and lungs. This low-dose CT scan looks for lung cancer and other lung problems. The CT images also provide a coronary calcium score to determine if plaque is built up in your heart arteries. This test does expose you to radiation and takes only a few minutes to complete. They charge $349 for this test. Another company that provides testing is Prenuvo. Their test, called Enhanced Screening with Whole Body Scan, includes an MRI of the whole body except the arms and feet, and includes blood work that looks for cancer markers. The cost is $3,999. The Prenuvo whole body scan includes head, neck, chest, abdomen, pelvis, and legs, and it's checking for cancer, aneurysms, and disease for the price of $2,499. For $999, you can have their torso scan, which is an MRI of the chest, abdomen, and pelvis. Both companies use radiologists to read their MRIs and CTs. So who should consider this testing? Well, it would be good to discuss it with your provider to help make this decision. If, for example, you have a family history of cancer, it might make more sense for you to get genetic testing for specific genetic mutations rather than having a whole body scan. Having this information, the genetic information, really can help determine the best screening imaging for you based on your genetic patterns. Someone who worries and stresses about their health should really think twice before having testing like this done, because having this information about even minor physical problems could cause more stress. It is also important to note that, to date, there is no documented evidence that total body screening is cost-efficient or effective in prolonging life. Here's the Galleri episode. Enjoy.
I was having dinner with friends a few days ago, and they asked me what I knew about a blood test that looks for lots of different types of cancers, and if they should do something like that. I figured if they were asking this question, all of you listeners may have the same question. So I'm going to talk about one such test called the Galleri test, and that's spelled Galleri. The Galleri blood test can detect more than 50 different types of cancer. It looks for patterns in circulating DNA that can signal the presence of cancer in your body, and its accuracy can vary by cancer type. It also tells you the location in the body of circulating DNA that's abnormal. The Galleri test is a multi-cancer early detection test. They label that MCED, Multi-Cancer Early Detection Test, MCED. It is produced by a company called Grail, as in the holy. It can be used to identify cancer in asymptomatic adults who are at higher risk of cancer, like those who are over 50 and over, like me. It is not indicated for people under the age of 21 or for those who are pregnant. There are some other companies who have blood tests that look for a single cancer, like colon cancer. But I'm going to talk today about the Galleri test that looks for over 50 types of cancer. The Galleri test requires a blood sample that is collected by a simple blood draw. Most, if not all of you, have had this done, so you know that it involves collecting a small amount of blood from a vein in your arm or sometimes your hand if you have tricky veins. The blood sample is then sent to a lab where the blood is analyzed for cell-free DNA using DNA sequencing and machine learning. Okay, I don't know about you, but I had no idea what machine learning meant. Forrest is probably rolling his eyes as he hears this while producing the episode. Anyway, I had to look it up, and according to MIT, the Massachusetts Institute of Technology, machine learning is an artificial intelligence system, which is probably why I didn't know anything about it, that is used to perform complex tasks in a way that is similar to how humans solve problems. There you go. Anyway, the system is looking for cell-free DNA, which is a type of DNA that's been released from cells and is present in the blood. So it's not contained within a cell. It's been released from a cell and it's hanging around in the blood. There are differences in the cell-free DNA of healthy cells and cancer cells. The Galleri test looks for specific patterns of changes in the cell-free DNA that may signal that cancer is present. It can also identify the area in the body where the cancer may be. These tests do not diagnose cancer. These tests do not diagnose cancer. A positive result will probably lead to additional imaging tests or biopsy to confirm a diagnosis of cancer. At this point, medical experts say the tests aren't replacing the screening tests that are currently standard of care, such as colonoscopy, mammography, or pap smear. Because MCED can help find cancers in their early stages when they're easier to treat, this type of test can be used to supplement our current screening test. So they supplement but do not replace our current screening tests. The Galleri test can identify, as I said, more than 50 types of cancer. So clearly, I am not going to list them all here. You can say thank you now. Thank you, Karen. But it does include some of the most common cancer types, such as cancer of the breast, lung, prostate, colon, and rectum. The test can also identify cancers that are much less common and that are not typically screened. A couple of examples include ampullary cancer, which is a rare form of gastrointestinal cancer, and also it can detect certain types of soft tissue sarcoma that are commonly hidden deep in the body. So sarcoma is often diagnosed when it has already become too large to expect any hope of being cured. Although a lot of lumps and bumps we get are not cancerous for sure, you should have lumps looked at by your provider when you first notice them in case it's a sarcoma. We want to make sure it's not a sarcoma. The test may be especially useful in finding what we call silent cancers, like pancreatic or ovarian cancer, both of which often don't cause symptoms until the disease is advanced and more difficult to treat. There are some things that we do not know about the Galleri test. One unknown is whether or not using it as a part of cancer screening will help to improve people's outcomes and save lives. There are clinical trials currently in progress to help determine this. The largest trial is the NHS Galleri trial, which is currently underway in the United Kingdom. The goal of the trial is to see if using the Galleri test along with established cancer screening methods can help to find and treat cancers earlier. About 140,000 people with no history of cancer in the past 3 years volunteered to take part in this trial. Everyone in the trial will have 3 blood tests over 2 years. Half of the participants will have their samples analyzed using Galleri. The other half will not. The National Cancer Institute, the NCI, is also studying the benefits of MCED tests such as Galleri in preventing cancer deaths. This year, 2024, the preliminary study will enroll 24,000 healthy people. If MCED tests in this study are found to be useful, a larger study of up to 225,000 people will be initiated. In the meantime, there are anecdotal reports of the benefits of the test. A Washington Post article dated April 16, 2024, had 4 of these personal experiences featured. When her husband was undergoing cancer treatment, a woman who lives in Florida found out about the Galleri test, and her husband encouraged her to take the test in spite of the fact that she was a healthy 50-year-old woman without any symptoms. She was quite surprised when the result came back positive. She had follow-up scans that revealed a small tumor in her groin, which was diagnosed as a rare but aggressive form of cancer called mantle cell lymphoma. She underwent treatment, and now, 2 years later, she's in remission. The Florida woman states that, quote, "For me, the test was a miracle, a real big miracle," end quote. A 56-year-old woman from Arizona had a positive Galleri test, so a follow-up MRI found that she had, in her words, an angry gallbladder that needed to come out. So she had no symptoms, but the pathology on the removed gallbladder showed a small malignant tumor among the gallstones. After treatment, the woman reports that she is now cancer-free. Up ahead, more stories of how the Galleri test benefited people, so stay with me. Welcome back. I want to share with you a couple more stories of people who had personal experiences with MCED testing. A 75-year-old woman from Pennsylvania had a test done when she was enrolled in a 2018 study called Cancer Seek. She had a positive test, and follow-up scans revealed leiomyosarcoma in her uterus. She had a hysterectomy, and the woman reports that the surgeon was able to remove the entire tumor. The Washington Post article quotes her as saying, quote, "I don't know how aggressive it would have been, but I have one grandchild and I was able to see him graduate from high school. I'm looking forward to his college graduation and later to my great-grandkids," end quote. A final story is that of a 69-year-old man from California who agreed to do the Galleri test when his physician suggested it. Everything about that annual exam, including his blood work, was normal, so he was surprised to be told that the Galleri test came back positive. Follow-up testing found cancer in a lymph node under his right armpit, which turned out to be a form of Hodgkin's lymphoma. After radiation and chemotherapy, he reports that he's currently cancer-free. He states that if he hadn't had the test done, quote, "Where would I be now? Who knows? But it wouldn't have gone away," end quote. So how accurate is this testing? A 2021 validation study looked into the accuracy of the Galleri test. It included 2,823 people with a known diagnosis of cancer and 1,254 healthy people, no cancer. The study found that the Galleri test had 99.5% specificity, meaning it was very accurate for determining when a person didn't have cancer-related signals in their sample, making false positive results very unlikely. The overall sensitivity was 51.5%, meaning that it correctly identified 51% of the people with cancer-related signals in their sample. The test missed cancer-related signals in the remaining percentage of people, which means 48.5% of the people. This means that these people received a false negative result. The sensitivity of the Galleri test improved with higher stages of cancer, meaning it was more likely to identify cancer-related signals in people with more advanced cancers. The study also found that in those who received a positive result and had cancer, the Galleri test correctly identified the site of origin of the cancer in 88.7% of people. Pretty impressive. There are some downsides or risks to the Galleri test. First, although it can look for over 50 types of cancer, it doesn't detect all types of cancer. So you can still have a type of cancer that the test cannot find, even if you have a negative test. Secondly, there is a chance that you could have a false negative test, meaning that the test is negative when you actually do have cancer. In this case, a negative test can give you a false sense of security and delay necessary testing to discover the cancer. Thirdly, although studies show the rates of false positive and negatives are low among the new cancer blood tests, a false positive could cause a lot of anxiety and lead to invasive and costly tests. If you're interested in having the Galleri test, talk with your provider about it. If they are knowledgeable about MCED, they can help you determine whether or not you're a good candidate for the test and also provide you with the information about different benefits and risks associated with the test. The Galleri test has a list cost of $949. According to Grail, the company that makes the test, some individual employers may cover some or all of the cost of testing. Both the American Cancer Society and the National Cancer Institute report that most types of insurance don't typically cover the Galleri test. This means that you'll likely have to pay some or all of the cost of the test out of pocket. Medicare currently does not cover the cost of the Galleri test either, but a bill on this topic was introduced into Congress in 2021. I checked the status of the bill today on congress.gov, the website congress.gov, which states that it has been, quote, read twice and referred to the Committee on Finance, end quote. The last update on the progress of the bill was in June of 2023. If enacted into law, which at this point seems unlikely as it sits with the Committee of Finance, it would provide Medicare coverage for MCED such as the Galleri test. At this time, no MCED tests have been approved by the Food and Drug Administration, the FDA, and this includes the Galleri test. Instead, the Galleri test is available under a Clinical Laboratory Improvement Amendments, CLIA, which we call CLIA waiver. Since the actual testing of the sample is done in a central laboratory regulated by CLIA. CLIA is a federal program that sets and ensures quality standards for clinical laboratory testing. The Galleri test was also given a breakthrough device designation by the FDA in 2019. The FDA's Breakthrough Devices Program designates medical devices that may increase the effectiveness of the diagnosis or treatment of life-threatening diseases. The goal of providing this designation is to provide timely access to these devices while they are being further developed and studied. So, If you're at an increased risk of cancer, a medical provider can order the Galleri test on the Galleri website. Today, I've outlined the risks and benefits of this testing for you, but you should review them with your healthcare provider to help determine if the Galleri test is a good fit for you. And if it is, hopefully, your provider will be willing to order the Galleri test or other MCED test for you.
Thank you for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings really do matter. Also, make sure you follow the show so that it will be automatically downloaded. That matters a lot. I encourage you to visit our Facebook page, IMB Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. As always, thanks to Forrest Wenzel, my son, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you so much, Forrest. Forrest has begun his second year of his master's degree in music composition at Peabody Music Conservatory and is already loving it. I am so very proud of him. And please remember that your health is in your hands.